Hi, this is Mark Graben. This is a post that I published on February 23rd, 2017. This is episode 183 of Lean Blog Audio. The post is titled, "If a surgeon or hospital puts quantity over quality, why call it a factory?" Now, in this post, here's the summary in less than 50 words. I've been doing that recently. I get worked up about labeling a troubled surgical department as a factory, but there are far more important issues of patient safety and hospital culture to be discussed related to a Seattle Times investigative piece. Here's the post. Next week is the annual Society for Health Systems Conference, and you can see past blog posts from previous conferences. I've linked to that and the Seattle Times article you're going to want to read. I'm sure. Go to leanblog.org/audio183. Now, I'm attending the SHS conference and participating again, as I do almost every year. It's a great event that's focused on process improvement. Let me know if you're going to be attending, and please say hello, or you can follow the conference hashtag SHS2017. Since SHS is part of the Institute of Industrial and Systems Engineers, many of the attendees, like me, have worked in both manufacturing and healthcare. We're able to see parallels and differences between the settings, and we understand, at least to the best of our ability, we understand how process improvement and leadership principles are transferable across industries. We're working to make hospitals better hospitals. That doesn't mean, quote unquote, turning them into a factory, as people might fear in healthcare. Now, I understand when healthcare people have trouble seeing what would be transferable from manufacturing, especially when many of them have never set foot in a factory. They don't know what good looks like in manufacturing. They wouldn't necessarily know the difference between a modern lean factory that you would want to learn from and a bad traditionally run factory, like my GM plant was in 1995 when I worked there. Now, I get frustrated, though, when people make broad generalizations about factories being backward or being crappy workplaces, as I've blogged about before. I read with interest when this Seattle Times article invoked the term factory when writing about a hospital and a surgeon who are accused of putting quantity before quality, and I guess this applies to the management team as well. My GM factory sadly did that in 1995, putting quantity before quality. I've seen that outdated mindset in other factories that were still early in their lean transformation. But again, we need to distinguish between factory as a general term and bad factory. So when you go and read the investigative piece from the Seattle Times, it's interesting on, I think, many levels. It refers to the quote unquote OR factory as if all factories are, sweatshops that crank out poor quality products. Again, that's as unfair as saying all bankers are crooks or that all restaurants would give you food poisoning. Now, in the Seattle Times article, the word factory doesn't get used in the body of the article. I think that's kind of interesting. The word lean, thankfully, doesn't enter the discussion either. People sometimes incorrectly think lean means pressuring people to work faster. Well, no, lean is actually the opposite of that old mindset and approach. Lean puts quality first and truly empowers people to improve quality and to make that a priority. In a nutshell, the accusations and the counterclaims from the article are, including these points. A surgeon, Dr. Johnny Delishaw, is accused of prioritizing money, quantity, and volume over clinical best practice and quality. He denies that. Many staff members and other surgeons have quit or complained about his practices and behavior. The surgeon claims they are jealous or resistant to culture change. The surgeon payment model has been changed from pooling some revenue to encourage teamwork to a strictly individual RVU payment scheme. It's alleged that a state law meant to encourage patient safety is being used through a loophole to force nurses to work 20 hours in a 24-hour period. Some claim they're afraid to speak up in M&M reviews, but the surgeon claims he's not a bully. Poor outcomes are blamed on the surgeon having concurrent cases or being in clinic while, quote unquote, his patients are in the OR being worked on by residents or other surgeons. Delishaw was promoted into a leadership role despite concerns that were raised by colleagues. And hospital leadership seemed to diminish or possibly ignore the allegations. There are a lot of concerns and problems here that you would hope hospital leaders would take seriously. Calling a bad hospital a factory doesn't shed any light or help the discussion. The problem is putting quantity over quality, as the article accuses them of. I'd criticize a factory or a hospital or any organization for doing that. In the follow-up to their investigation, there's this news, a different article I've linked to that says, Swedish Health Services CEO Tony Armada has resigned, days after a Seattle Times investigation examined turmoil and troubles inside Swedish's premier neurosurgery institute. The article also has a shorter synopsis of the investigation where it says, the Times reported that doctors have expressed concerns to Armada and other administrators about patient safety issues at the Neurosurgery Institute, particularly when it comes to Delashaw. 10 surgeons and staff members met with Armada in October, with some making desperate pleas to remove Delashaw, to detail their concerns about the shifting culture at Swedish, according to minutes from that meeting obtained by the Times. The meeting minutes include these notes. It says, the meeting was held under the premise of the 5 Swedish bests: best place to work and practice, best customer experience, best quality and safety, best health outcomes, best use of resource. The investigation and the meeting minutes seem to suggest those bests or values aren't always being lived up to. The CEO, Armada, stated, quote, patient safety and quality are our first priority, end of quote. Well, they always say that, as I've blogged about before. The key is translating that goal into daily practice, as I've also written about. There's links to these past blog posts, again, at leanblog.org/audio183. So I'm curious what you think of any of this. Is in the grand scheme of things, using the word factory and pointing that out probably is the least important issue out of everything here.